Hello, future Rossies and pre-med explorers. This is Milena Garcia, your host for Ross University Checking the Pulse, a pre-med podcast. This is our mini podcast featuring facts and information about our medical program, insights from current students, and tips from practicing physicians. Each week, this broadcast will be broken down in small episodes, focusing on one aspect of our program, also having guests talk about their own experiences as students and as doctors. To be successful in medical school, the students need support. At Ross University School of Medicine, we are committed to assisting our students in different ways and from different angles. A major part of our support strategy encompasses the Academy for Teaching and Learning, also known as the ATL. My guest today is Dr. Maureen Hall, Associate Professor of Medicine and Certified Academic Coach. Dr. Hall is a member of the ATL, and she's joining me to talk about one of the most frequent issues we see on campus, anxiety. Welcome back, everybody. Thanks for joining us. Now, joining me today is Dr. Maureen Hall. Dr. Hall, thank you for joining us. Please, let's take a moment to have you introduce yourself to our listeners.
Hi, I'm Dr. Maureen Hall. I am an Associate Professor of Medicine at Ross University School of Medicine. I've been with the institution for the past 11 years. I serve in a variety of capacity. I serve as an advanced academic coach, an author. I'm an educational scientist with background in lifelong learning and medical simulation. My role primarily involves individual coaching, as well as small group teaching and helping students with metacognitive skills as they develop their lifelong milestones.
And Dr. Hall is part of the ATL, the Academy for Teaching and Learning. Dr. Hall, what is the ATL?
Okay, besides saying that the ATL stands for Academy for Teaching and Learning, ATL really is a group of faculty with expertise in a variety of background that supports all students, not just struggling students. And I want to clarify that because many people think that, ATL is just for strugglers. It's not correct. ATL supports all students, and everyone needs a help in a variety of different things. And so we provide those services for you. There are times when we work with a student, we may need to refer them to another department, and that's okay. And sometimes other departments such as counseling or exam center or your mentor or medical sciences or clinical sciences, they always refer to students to us. So we provide support again for every student. It's not just strugglers.
Now, Dr. Hall, I think one of the biggest misconceptions I hear from incoming students is the fact that they assume that studying the same way that they did in undergrad or their graduate program will work in medical school. Can you talk a little bit more about how is medical school different from the undergrad and the grad institutions that our future Rossies are attending now?
Yes, this is a wonderful question. I love this because when we did the introduction to medical school, we always ask this question: how is medical school different? And the number one answer we would get back from students is that the volume. Yes, indeed, it is the volume, but it's a little more than that. It's just managing your time. Time management is key. So we talk a lot about time management and working with that because if students can manage their time appropriately, this work is very easy. That's number one. The other thing I want to highlight here is the higher order of thinking. Many students come in and they're able to memorize things very well. They're a great memorizer. They're great. They can. Some students say, I'm a visual thinker. I'm a maybe I'm a hands-on person. But the main thing is really being able to critically think. And critically thinking is just asking yourself questions about the content that's being presented to you and how best you can, once you've gathered the main ideas, how best you can apply them. Because what we really test you on, based on the exams that you will be getting, it's based on application. So it's not, even though you have to remember things, you have to understand it, you also must be able to apply it. And so I use this motto or quote that I would share with students, and I would tell them, I need you to analyze more than you memorize. And so they look at me startled. Like, how can I do this? Yeah, so memorizing is very easy to do. But if you understand why you need to memorize something, if you can analyze it and you can apply it, application helps with understanding, which helps with memorization. So analyze first, then memorize.
And what are some of the issues you see the students have with this amount of information that's being thrown at them?
Oh, yes. Yes, sometimes it can be overbearing for some students, and as a result, they become over anxious. Anxiety is a key. And sometimes with this anxiety, I want them to make sure, is it something that is underlying? We're not sure if there is a medical condition. So it's always best to be checked out by your medical doctor to be sure that this anxiety that you may have is not something that is just because of the overwhelming content. It could be medical as well. The other number two, I would say, is depression. Some students, once they feel the volume and you're competing against yourself, when I say that, I mean that so many people are going to be just like you, just as brilliant as you are, and you're competing with these brilliant people. And so that itself is more overwhelming, and sometimes students become depressed because they're not performing as well as they want to or they think that they should be, and so it leads to depression. Again, you always think about your loved ones, and so if somebody in your family is not well, or you not yourself not well, you tend to become a little depressed about it, but the pace and how things are happening. And finally, I would say loneliness. Don't be afraid to reach out. Everybody's together, and we're here, Ross. We're all our Ross faculty. We love our students, and we want to share, and we want to help you. But we can't help you if we don't know what you need. So it's always good to reach out. So loneliness can be an issue, and that's one of the reasons why we tried at the very early part of our program to bringing the routine of study buddies and how to form groups. And sometimes some groups are officials, as well as sometimes you can work on them on your own. But again, I agree that this loneliness is something that students tend to deal with.
I think those three also integrated, right? And one can lead to the other, and it becomes
Yes.
a vicious cycle.
Yes.
Yeah. So as far as this anxiety and depression and loneliness, what can the students do, the pre-med or our current med students, to prevent or overcome this anxiety?
Okay. Once the anxiety can be overcome firstly with thinking out of the box. Thinking out of the box, seeking help when it's needed, working with groups, asking for support, studying efficiently and effectively. How do you do that? That's what ATL does. We provide you with those information. And the key thing is everyone is different. Even though sometimes we have a large group session, and there are times we have to have a smaller group session. And there are times when we have to have that individual talk with you, because every one of you are unique. And so we provide this, and we can provide scales of how your anxiety may be. If it's something that we need to refer you to the counseling center for, we have a center that we provide extra support for students. Sometimes you come with it, your medications may need to be adjusted, but there may be a variety of reasons why the anxiety is there. But we at ATL help with the first set of people that can help you to get the support that you need to overcome the anxiety that sometimes come with not being prepared.
What about self-doubt?
Self-doubt. When I think of self-doubt, I think of fear. A lot of students come with fear, thinking that, oh my goodness, this is so much. There's no way I can do this. And if this one, oh, I wonder how she did this. I wonder how he did this. They're looking at everybody else but themselves. But every one of you can do that. And that's why I love the department that I'm in. I love the work that we do, because we believe each student that we've accepted is a genius. Each student that we've accepted can do this work. And if you don't know how, we will show you how.
Right.
Because we know you have the talent to do it. And so that's how we help the student. But then when students become overwhelmed with lack of belief that they can do this work, they have this fear, and the fear paralyzes them, shuts them down. They won't seek help. Then loneliness comes in. Then that comes another cycle. Here comes depression, and here comes anxiety.
So right back where we started, right?
Right
Yes.
back where we started.
And you mentioned this is where we come in. So can you talk a little bit more about some of the examples of what we do here at Ross to support the students?
Oh, yes, yes. So, with the Academy for Teaching and Learning, the ATL, we provide support to students. What we do, we provide a pre-matriculation course, as you may understand that some of the other videos that talked about this.
Yes,
We
we did.
provide,
Thank you
yeah,
for pointing
we
it
can,
out.
yes. During our orientation, we provide strategies, cognitive skills workshop strategies that give you the information up front. We prepare you with all the tools that you would need in advance. So before medical school day one starts, you have an idea of what your schedule will look like, how to deal with your time, how to study efficiently, how to be effective, where to find things, the resources, who are your faculty. All of these things will be provided with you so you're not lost. But then there's a lot of it coming at you, so you may not remember every single thing. So then we come back. If there's ATL, we provide individual meetings, because what may be an issue for someone or someone may need a support for, you may be a little different. So we individualize our support, and that's what I like most. And some students prefer to be seen before day one of classes start. So we provide individual support before the classes start, and then we try to put things in during week one. We also have a peer tutoring program, not just the ATL faculty, but also the peers who've gone through what you will be going through to provide the support for you, and that is under the auspices of the ATL. We have our mentoring program that also provides that support for you. So we work in a collaboration to provide the support for you. And again, it can be in large group, small group, but also that individual component is also helpful. And we also give students resources. We have a web page that we provide resources for students, test taking strategies, even dealing with anxiety, how to create a schedule. All these things that we know that students that always come up, we provide these support for our students.
And for everyone listening, we did do an episode entirely on the ATL, as Dr. Hall mentioned. So make sure to go back and check that out as well. Dr. Hall, how do you feel the students can improve their positivity?
Now, that is great. That's one great way the students can overcome anxiety is by staying positive. You have to keep alert, keep an open mind. In terms of the activities and extracurricular activities that we have, you can be a part of those groups as well that provide tips and information and encouragement about how to work through your programs or how to work through these courses. We have the TAs that provide, the peer tutoring that provides support for our students and helping them to use the resources that they have earlier. It's best to use them earlier. The sooner you reach out and to use the resources. When I say resources, I'm referring about tips that we would put on our website. Coming and seeking help from an academic coach within the ATL. If you have an issue with biochemistry, you may have been away from biochemistry for a longer time. Just meet with a faculty and say, I have reviewed this content, I've looked at your learning objectives, I have looked at the lecture presentation, but I'm still a bit confused. So at this point where you can let the faculty know what your issues are, and they will provide the resources to help you. And again, we at ATL can help you to see, well, how best to approach biochemistry. Or if it's anatomy, how best to approach anatomy. We can provide you with tips individual to how you learn. Whether you are a visual learner or an auditory learner, we provide those support for you.
And it's not the same, right? Studying for biochemistry may not necessarily be the same way of studying for anatomy, for example.
Yeah. That is correct. And we could just work with you and observe you and see how we can help that to you can improve and be able to make the best out of whatever subject it is. And I've seen students done it. And if students have done it before you are coming, you can do the same.
Dr. Hall, this is great information. I certainly appreciate you taking the time to join us. Do you have any last suggestions or advice for our future Rossies on how to be successful in medical school?
Yes, I do. So first, I want to tell you, come with an open mind. You are welcome here. We have accepted you. You belong here. And then the second thing, and I will say, stay positive. There are some positive people around. Some people are more positive than the others. Stay with positive people. Share your schedules with your loved ones, your family. If you're distant away from them, this may be the first time you're away from home. You want to share them to let them know what is going on and make sure that you have the support that you need, that person that you can call on to help you, to be there just to give you a word of encouragement. Some of these things, having your background or your source, knowing of whoever it is, whatever it is you believe in, that you need to be able to call on, have it there. And also you want to make sure self-care. I can't overemphasize self-care. Taking care of yourself, loving yourself, having faith in yourself, believing in yourself. Those things are good. So with that said, you can't study for a long time without taking a pause. You have to keep up with your nutrition. You have to take your supplements, right? You have to remember to do your exercise. Those of you who bring your dogs, your pets along, it's a good time to make sure you find time to walk outside and enjoy the sunshine that we have here in Barbados. Yes, so it's just being well-rounded and believing and seeing yourself achieving the goal that you've set for yourself. And I guarantee you that it's able to be attained. And that's what we're here for, to support you as you obtain your goals.
Absolutely. And please, everybody, take advantage of this. Dr. Hall has been with us for a long time. She's worn many hats. She wears many hats. So she knows what it takes to get everybody there successfully. Dr. Hall, thanks again for joining me. I appreciate you sharing all this information with us.
Thank you. My pleasure. And I'm looking forward to seeing you around campus.
Thank you. Same here. Bye. Take care.
Thank you for listening to Ross University Checking the Pulse, a pre-med podcast. This is Milena Garcia, your host. This podcast is made for you, so let me know what topics you want us to cover on future episodes. You can send me your comments, feedbacks, and requests to mgarcia@rossu.edu. Definitely follow us on Instagram, Twitter, and our YouTube channel at Ross Med School, or on Facebook. If you're listening to this podcast on iTunes, I am working my way to 5 stars, so remember to send me your comments and let me know your ideas. If you're on Spotify, remember to click on the follow button to get our future episodes. All right, see you future Rossies and Pre-Med Explorers next week. This mini podcast is edited and produced by our in-house guru, Chris King.